I am going to give a presentation about magnesium and trace and toxic elements of chromium. The magnesium is the first topic to discuss. Magnesium is the fourth most abundant cation in the body after sodium, potassium, and calcium, and second most abundant cation in intracellular ion. Magnesium is needed in many enzymatic reactions. Magnesium-dependent are ATP metabolism, muscle contraction and relaxation, normal neurological function, and release of neurotransmitters. Magnesium binds to other nucleotide phosphates and to nucleic acids, required for DNA replication, transcription, and translation. So magnesium, it also helps adjust blood glucose and help and muscle function. Distribution of magnesium. The average human body contains 24 grams of magnesium. Approximately 53% resides in the bone, 46% in the muscle and other organs and tissues. Less than 1% is present in serum and RBCs. 1/3 is bound to protein, primarily albumin. 61% exists in the free or ionized state, and about 5% is complex with other ions, such as phosphorus and citrate. Sources of magnesium include raw nuts, dry cereal, and hard drinking water, vegetables, meats, fish, and fruit. Processed foods have low levels of magnesium that may cause an inadequate intake. The reabsorption, the overall regulation of magnesium is controlled largely by the kidney, which can reabsorb magnesium in deficiency states or readily excrete excess magnesium in overload states. Of the non-protein bound magnesium that gets filtered by the glomerulus, only 25% to 30% is reabsorbed by the proximal convoluted tubule, in which Henle's loop is the major renal regulatory site where 50% to 60% of filtered magnesium is reabsorbed in the ascending limb. In addition, 2% to 5% are reabsorbed in the distal convoluted tubule. Functions of magnesium and its role in enzyme actions. Cofactor for more than 300 enzymes in the body. Magnesium is an allosteric activator for many enzyme systems. And membrane function, cell adhesion, transmembrane electrolyte flux. Hypomagnesemia is most magnesium deficiency can thus result in a variety of metabolic abnormalities and clinical consequences. Hypomagnesemia is common in hospitalized individuals in ICU or those receiving diuretic therapy or digitalis therapy. These patients most likely have an overall tissue depletion of magnesium as a result of severe illness or loss, which leads to low serum levels. So, hypomagnesemia is rare in non-hospitalized individuals. So um, the treatments of hypomagnesemia, the preferred form of treatment is by oral intake using magnesium lactate, magnesium oxide, magnesium chloride, antacid that contain magnesium in severely ill patients, and magnesium sulfate solution is given parenterally. So um, hypomagnesi hypomagnesemia hypomagnesemia hypermagnesemia. Symptomatic hypermagnesemia is almost always caused by excessive intake in antacids, enemas, cathartics, therapeutic eclampsia, cardiac arrhythmia. Mild to moderate symptoms such as hypotension, bradycardia, skin flushing, increased skin temperature, nausea, vomiting, and lethargy. It may occur when serum levels are 1.5 to 2.5 millimole per liter. Life-threatening symptoms such as ECG changes, heart block, acetol sedation, coma, respiratory depression or arrest, and paralysis. It occurs when serum levels reach 5.0 millimole per liter. Hypermagnesemia, the most frequent symptoms involve cardiovascular, dermatologic, gastrointestinal, neurologic, hemostatic, metabolic, neuromuscular. Methods of estimations. Calmigite. Magnesium binds with calmigite to form a reddish-violet complex that may be read at 532 nanometer. Farmasan dye. Magnesium binds with the dye to form a colored complex that may be read at 660 nanometer. And methyl blue. Magnesium binds with a chromium to form a colored complex. So the reference method for measuring magnesium is the atomic absorption spectroscopy. Reference range: serum colorimetric 0.63 to 1.0 millimole per liter, 1.26 to 2.10 milligrams per deciliter. This ends the magnesium discussion. I'm now going to talk about chromium. So chromium symbol Cr and atomic number 24, atomic weight 9,961 grams per mole. Transition metal 25th most abundant, and steel gray, mostly known as the chrome, exists in multiple valence states. Absorption, tissue, distribution, and toxic potential varies with valence state. Toxicity: Trivalent chromium have not been shown to be toxic to humans or animals. Hexavalent chromium is taken up easily. Toxicity more likely if inhaled can cause carcinoma of the bronchial system. Is postulated that it binds to DNA. Acute GL ulcerations in its symptoms, in chronic depressed growth, liver, and kidney damage. The function of chromium is act cooperatively with other substances such as hormone, insulin, various enzymes, the genetic material of the cell, DNA, and RNA. The overview of chromium used in manufacturing of stainless steel. Occupational exposure occurs in wood treatment, chrome planting, leather tanning. Essential dietary element plays a role in normal metabolism of fat, glucose, cholesterol. Absorption, transferrin, and albumin involved in absorption and transport. Transport, transferrin, and albumin involved in absorption and transport. Toxicity, one form of chromium is more toxic, causing dermatitis and skin ulcers. Lab evaluation, mass spectrometry and atomic absorption spectroscopy. And that's it. Have a wonderful day.